Cryptic pregnancy. How can you be pregnant and you don't know? Like, you don't know. You just wake up in the one day and then you're having pain. Your stomach is paining you. It became so unbearable that you pressure when you now get to the hospital. They now tell you that you're about to give birth. I mean, you didn't even know. So we're going to be discussing about cryptic pregnancy, everything you should know about cryptic pregnancy. If you're coming from Facebook or TikTok, that video is different. Okay, so just listen attentively. Well, my name is Nurse Mary. I'm a nephrology nurse. So if you have questions in regards to your kidney, heart health, you can click on the link on my bio to book a consultation with me. It's not free, okay? Or you can put it on the comment section or my Instagram. Those places are free. So now, let's get to it. Now, cryptic pregnancy can happen to anybody, okay? And these are usually the reasons why cryptic pregnancy occur. Number one, probably you've just given birth and you just gave birth 2 months ago or 3 months ago, and of course you're thinking there is no way you will get pregnant. So you may be noticing the symptoms of pregnancy, but you didn't check until you now see your stomach bulging out, and that is one of the reasons of cryptic. You now check and then they say you're pregnant. I'll start from the lesser reasons to the higher reasons. Number two, if you have polycystic ovarian syndrome, these PCOS symptoms are usually the symptoms of pregnancy. So you're used to noticing these symptoms, and when you now see it, you're now thinking that is it the same thing, until you see your stomach getting big. The next thing that can mimic this cryptic pregnancy is now a false pregnancy test. Okay, probably you checked and then you see that you're not pregnant and all. Now let's get to the point. Now, cryptic pregnancy, what is cryptic pregnancy? Is when somebody just it didn't experience. Some people experience the symptoms of pregnancy while some don't experience the symptoms of pregnancy, and they end up until about 8 months, until about 9 months, and then they start experience the symptoms, or their stomach is bulging, or until labor starts. That's when they now notice that they are pregnant. Now, these are the things that may suggest that causes cryptic pregnancy. Number one is if you have a retroverted uterus. Okay, retroverted uterus means your uterus is tilted backwards instead of up frontwards. Okay, this happens in 1 to 5,000 women, 500 women, I think. So those women, their uterus is at the back. So because of this, normally when your uterus is anteverted, when you're pregnant, your baby, as the baby fetus is growing, your uterus is bulging out. It is bulging out and protruding your belly, right? This is happening, your belly is becoming big. But when those people that have their uterus at the back, as the baby is growing, the uterus is at the back, protruding towards the spine. So there is no way you will know that there is something going on there. That's number one. Number two is when your core muscles are very tight. Like for people that work out very, do core exercises, they are top-notch core strength exercises. So when their core is tight, so usually those that have packs, not everyone anyways, you may have 6 packs and then your core muscle is not tight. So when the uterus is bulging, the uterus may be bulging, developing around their core, okay, their core muscles, and then not the belly will just slightly bulge, probably around 7, 8, 9 months, or it may not even. The next one is when you're very tall. People that are very, very, very tall, they experience their uterus also may, because of the spine is long, so their uterus are also, sometimes their uterus develop in the spine. When the baby is growing inside the spine instead of bulging outside the abdominal area. So they may have small baby bump. Now, another one that can cause this is endometriosis, or when there is scarring of your uterus. Okay, these ligaments, when they are scarred, when you are now pregnant, the ligament hold the uterus so tightly that they can't budge out. The baby is developing, but the uterus is not budging the belly out, something like that. I tried to explain it in a layman's language. So cryptic pregnancy is very, very real, right? It's very, very, very real. So it can happen to any woman, or like the other this thing I mentioned before. Probably you are sure that you took a contraceptive pill, or there's no way you'll be pregnant, so you will just be surprised that your stomach is getting big and big and big. So that's all about cryptic pregnancy. If you have more questions in regards to this cryptic pregnancy, put it in the comment section. Have a nice day. Bye.